it's an interesting encounter when you go to your gynecologist and you're told that you have fibroids. And for some of us, that's a frightening diagnosis. What are you supposed to do with it? What does it mean? Are they saying you need to have a hysterectomy? Are they saying that you won't be able to have children? What does it mean? And how do you evaluate this thing called fibroids? Now consider this. There are multiple ways that this can present itself. Sometimes you go into the GYN office with 0 complaints and your gynecologist palpates and says, I think you have fibroids. And you were totally not aware that this was true. Or the other possibility is that you're bleeding heavily, or you have pain, or you're not able to get pregnant, and you know that the reason is because of your fibroids. And so how does that get evaluated? So we're going to consider 2 separate scenarios. One where there's a clear complaint. I call it the BBPI. Either there's bleeding, the fibroid has gotten too bulky, or you have pain, or there's a problem with fertility, infertility, not being able to get pregnant. So BBPI, those are the symptoms that are usually associated with fibroids. The other scenario that we'll consider is you had no complaints. You go to the office and someone says they feel something, and you go and it's confirmed. You go for an ultrasound and it's confirmed that you have fibroids. And the question is, so what do I do about it? How does this get evaluated? There's some baseline things that you should consider. In the scenario where you're not having any complaints, things that you should double check. You should check your hemoglobin to make sure you're not anemic. You should check your ferritin level to see that your iron levels aren't abnormally low. And you should check your vitamin D level. Once you know that there is a deficiency, an iron deficiency or a vitamin D deficiency, these are 2 areas that you could address that could possibly result in you feeling better and possibly helping to control the rate of growth of your fibroids. All of this is newer research where we're starting to understand that fibroids aren't static. They vary from woman to woman. The treatment will vary from woman to woman. It's a dynamic process. For some women, fibroids stay stable over a long period of time. Other women, fibroids grow rapidly. Some women just have one. Other women have multiple. It's a dynamic process, and it's a chronic condition in the sense that it can progress over time. And so what we are beginning to appreciate is that it can be a dynamic and a chronic process. And what we want to be able to do is to understand how it's impacting you. and we check these baseline labs, vitamin D, iron levels, to see are these areas that we can optimize your health that may help you in dealing with these fibroid tumors. Once you're diagnosed, and if you have no symptoms at all, you may very well want to monitor the fibroids to see are they changing in size. And the easiest way to do that is via an ultrasound. An ultrasound that's obtained maybe once or twice a year, depending on the size, number, and the location of the fibroids. We discussed this before, but I think it's just worth repeating. When we're talking about fibroids, sometimes it's one, sometimes it's multiple. Where it's located will often impact, determine your symptoms. And so we need to know number, size, and location of the fibroids. And if you're still asymptomatic and you've checked for iron deficiency or vitamin D deficiency, then you need to be vigilant and monitor the growth of fibroids over time. Other thing you need to consider while you are monitoring your situation and staying on top of it is your desire to have children. Maybe you're through with childbearing. Maybe you've yet to start and you want to have a consultation with your GYN as to when you are ready to seek out childbearing. How will these fibroids impact? Is there something that should be done proactively to optimize the situation when you choose to become pregnant? And that's where it's so vital that you know what your ultrasound shows, that you understand what it's saying, that you are clear on your priorities in terms of a woman. Are you ready to get pregnant? Do you plan to get pregnant in the future? Do you have no desire to get pregnant? You want to be clear on what it is that you want, and also you want to understand your health status, your own physical condition. Do you have what we call comorbidities, conditions that could affect you, such as a bleeding disorder, hypertension, thrombosis, just to name a few things that you need to understand about your overall health and how it may or may not impact on your fibroids. Now, so if you're diagnosed with fibroids but you're otherwise asymptomatic, you are doing diligence by maintaining a periodic assessment of your fibroids and a periodic assessment of what it is that you want in terms of your own childbearing ability and your overall health. Now, if you are a woman with fibroids and you are symptomatic with one of the BBPIs, meaning bleeding, bulk sensation from the fibroid, pain, or infertility, if this is a clear issue with you, you also have to do something very similar to your sister, in that the sister that I just referred to, in that you need to be able to assess your overall health status. You need to be able to assess your desire for childbearing. And I need to make a point. We live in a time where a woman who becomes a mother doesn't necessarily have to be pregnant, meaning that there are things like adoption and surrogacy where a woman can become a mother without having the experience of pregnancy. And this is a really important consideration for a woman who may be challenged by the presence of fibroids. A conversation to have with loved ones, a conversation to have with your physician, because there are options available to you that you can consider. So again, the baseline is your age, your fertility desires, your comorbidities. We touched on those briefly before. And then the fibroids always goes back to the size, number, and location of the fibroids. Once you have outlined where you are, what are your comorbidities, if you have any, what is your desire concerning pregnancy, childbirth, mothering. Once you've decided that, the next step is just to look at what is available to you. Currently, there are medications, there are procedures, and there's surgery. When we talk about medications, we're often talking about hormones or hormone receptor agonists or antagonists, or we're talking about procedures such as embolization or ablation, or surgery such as myomectomy and hysterectomy. Where you are, who your provider is, what hospital you're associated with may actually limit the options available to you. And so this is a conversation that, again, you need to have with your provider. Some options are newer than others. For instance, ultrasound-guided ablation is a relatively new procedure compared to myomectomy or hysterectomy. And so one of the questions you will ask in the consultation are, what are all of my options given my age, given my fertility desires, given my comorbidities, given my fibroid size, location, and number? What are all of my options, even if they're not readily available to me? And then once you have that, you can decide what's the best option for you.